Hey, it's Chris Beyer.
Chris Bowling, how are
Hey,
you?
CB. Good morning.
We have a special guest, don't we?
We do. We've got Dr. Todd Caze with us from the Caze Concussion Institute. So Todd and I know each other from a long time ago at our time together at the then known Judson College, not Judson University in Elgin.
Oh,
So we
yeah.
were we were dorm mates, and we've reconnected now in our professional life. So we're excited to have you back on, Todd, and joining us in Focus.
Yes, thank you.
Yeah, excited to be with you guys.
So we've done a lot of work as benefit consultants, trying to find the best possible way for our employees and their families to get the right medical care. And you're doing something very special when it comes to treating concussions. As Chris and I both have had our fair share in our athletic backgrounds, it's always been just take time, rest, don't do anything strenuous, make sure you don't fall asleep. But you're basically down for multiple weeks to a month with no hope of getting back on the field or on the court. So you've done a lot of work now working with concussion to figure out there's a different protocol that probably people don't know about that's really making an impact on recovery. So we want to get to know your background and a little bit about what you're doing that's unique in treatment of concussions.
Yeah, no, that sounds great. One of the things we have to think about is the way that we used to even approach concussion. It wasn't even a serious injury. All of us, are collegiate athletes, and it was, I'm holding up one finger. How many fingers am I holding up?
Yeah.
Okay, you only have 3 stars. You're good. Go ahead and go back out there.
Yeah.
And then if we actually called it a concussion, then like you said, it was like, hey, let's completely shut it down.
Yeah.
You don't have anything at all. And the disservice of that is we saw all these other advancements in sports medicine. So we had specialists in knee and elbow and shoulder, and we saw people who were getting fellowship trained just in that one
Right.
particular anatomy and that particular sports injury. And unfortunately, because we weren't considering this a very serious injury, we saw this lag in specialization. And so it wasn't really until about 20 years ago that we started to see this first fellowship emerge around concussion. And what's really unfortunate is there's only two now in the country. And I was fortunate enough to be the inaugural fellow of the Children's Health James Andrews Institute, where it was just pediatric concussion. So in my field, I'm a neuropsychologist. You have to really understand the adult brain first before you get into the kid brain, because there's just different neurodevelopmental considerations. It's a little bit more challenging. And so now we're starting to see, more people emerge. What's going to be amazing is by the time, our kids have kids, this is going to be a very normal place thing. But for myself, I'm currently one of maybe 25 to 30 in the country that have done a fellowship in concussion. And then as far as pediatric concussion, being the inaugural fellow, there's not only been 3 of us who've done it, just purely in pediatric concussion. So it's a newer field, and but the good news is that the research is so far ahead of where we were before, that there's some really cool stuff that obviously we'll get into more. And it probably sounds like snake water initially because it's just so vastly different than what we've been taught. But then all of a sudden, when you get into the science and we start to have a conversation about the rationale behind it, and we talk about the outcomes, you're like, oh yeah, like why have we not been doing this for years?
Right.
Well, it just makes sense when you talk about some of these other procedures, like the having people walking the day of a hip replacement and not just laying in bed for a week before they go home. I mean, that's come around and people don't think anything of it, but this was just very delayed in different protocol. So what are you seeing that's different today that you are doing from a care standpoint that is probably contrary to what most of us have remembered? This is what you do.
Yeah, I think the biggest hurdle that we run into is people being taught that rest is best. That's probably the first thing. I'll talk about a few things. And the reality is that rest is not best, and rest is actually detrimental. And so, I'll take a step back. In its simplest form, a concussion is a network disruption injury. And there's several networks that are disrupted after that injury. And the 3 main networks are oculomotor, which helps us control our eye movement, integrate visual information, our vestibular, which helps us control our gaze, our gait, and knowing where we are in space. And then our autonomic, which helps us control our breathing, our blood pressure, our digestion. In a very medical term, I'd say it helps us control all the things. And so what we don't appreciate is that, because there's a disruption, what are you going to do to almost get those things going and kind of grease the wheel?
Yeah.
And so that's where people miss out. They don't realize that, like, well, actually, getting the heart rate up, we know it helps improve sleep. We know it helps improve our mood. We know it helps improve our cognition. But yet what we end up doing is we take people either in the workspace who are very active or athletes, and then we say, hey, actually, now you can't be active at all.
Yeah.
And that kind of gets into the second, I think, myth, if you will, is that symptoms mean shutdown. And really symptoms just mean rest. So if we think about an ankle sprain, you don't just move your ankle like this, you get that full range of motion. And
Right.
really, if you're really doing rehab, you're finding those areas that are vulnerable and you're trying to strengthen those in order to get back to 100%. And so symptoms are really just telling us what networks are still being impacted and what networks probably need more targeted interventions.
Yeah, that's so cool. And just, I mean, it makes sense that we should evolve our thinking and treatment and process, but it's just, yeah, I mean, that makes so much more sense now when you really think about it compared to other injuries and how you would respond to it. So how are patients accessing you? You're in Omaha. You've got a smaller clinic, as you said, but you're one of few in the country. But how are you engaging with patients, and what do people need to know when they've had a concussion? How do they get in touch with you?
Yeah, no, that's a great question. So obviously, very rarely do we talk about some of the benefits of COVID and what we got from going through the horrific pandemic. But one of the things that did happen is while telemedicine was happening prior to the pandemic, and I remember even when I was in school, I did placements that did just telehealth to increase the importance of access. What's happened now is we have coalitions that are saying, hey, you know what? This access is really important. There's really not much difference between virtual and in-person appointments. And so I'm actually very fortunate through what's called SciPac to be able to see people virtually in over 40 states and counting. And the reality is that it's stacking up. At some point, it's going to just be a nationwide thing. And what's amazing about that is it just increases the access. So one of the things that really has changed the way that I practice is if you start treatment right away, a lot of times, at least in the sports setting, if it's not, a very serious injury, this is like a 5 to 7 day injury. So we do a Saturday morning clinic, and I would say over 80% of the time when we see an athlete on Saturday morning who got injured Friday, they're playing. They're not missing any games. And you might say, oh, wow, that's dangerous. But one of the things that you look at is, okay, if we're clearing people too early, is there any concern about re-injury? Are they getting re-injured in the next week or two? And because I'm a very data-driven person, last year, all the people that we saw through these youth partnerships that we have and through the virtual clinics, only one person got another injury. And it was 3 weeks after their injury. They had played multiple games, and this kid just got absolutely rocked and depleted from his skates. And so at that point, it was its own separate injury. It had nothing to do with, and so that's what I encourage families with is, we don't obviously clear you if you're not 100%, but because we know those networks, we can objectively measure, are those networks back to where we want them to be? And then once you're good, you're good. And I think people maybe have a lack of appreciation of how resilient our brains can be. Now, here's the thing, kind of going back to the rest is best. That's a little bit mind numbing, right? So when we were athletes and we're like, hey, go back out there, you're fine, you're only seeing 3 stars. What we're maybe not appreciating is maybe the reason why these didn't take that long is because we're literally going right back to integration immediately.
Good point.
And now it might be, obviously second impact syndrome, the risk of a more serious injury happening if you're playing while you're concussed is a very real thing. And I'm not saying we shouldn't have the protocols that we have, but just like any other paradigm shift, there's been this extreme to one side, and now we're kind of coming back to the middle. The other thing from a sociocultural standpoint is this is the only injury that has legislation around it. And I tell people all the time when I do talks, like, hey, what do you think would happen if we had legislation on ACL? We wouldn't have sports.
Right.
True. Yeah, because you'd be worried about all of those things. So I know the cool things, Todd, about us working together as well is as we've been able to develop the VIP network with NOMI, we've got you now as a part of access for our clients. So those employers that are accessing our direct network can have access to you when that concussion happens. So we're excited to see that debut as we, are in right now, the fall sports season, but certainly other reasons where that would make sense. But we appreciate you sharing a little bit today. This has been awesome. It's good to connect with you. learn about what you're doing.
Yeah.
Concussion.
I will say,
Yeah, no, that's
because you guys are 12 years younger than me. We didn't even have the word concussion when I played football in college.
Mhm.
There was no such word. It was, you look okay, get out there. You know, thank God, that has that has changed, because
Absolutely.
a lot of people that are in their 50s and 60s that played all through
Yeah.
college and had multiple concussions. I mean, I have no idea how many I had. We're going to suffer when we're later in life. I mean, it's just the way it is. So I applaud you, Todd, for digging into this science and changing how we basically rehab from this, because it's like you said, it's no different than an ankle sprain. You've got to rehab through this.
Yeah,
Absolutely.
the only other thing I would add, guys, is that, some people, one of the challenges we see is, well, why wouldn't I just go to my PCP? Why don't I just go to my pediatrician? And the way I liken it to is, hey, look, like, they're great for kind of triage. They're going to have a sense of what but if I have something wrong with my knee, I'm going to the person who does knee all day, every day.
Right.
And why wouldn't we do that with a brain injury? And the challenge is, if there's a little bit of a disconnect with people having the reps to really understanding how to objectively measure this. And so it's interesting. You'll hear a lot of times people will be like, well, I mean, we do X, Y, and Z, and we think we're close, but the reality is there's objective things that we can do and that are backed by the science and backed by research, and it's a rep thing. So the measure we're talking about is the vestibular motor screener, and I'm up to about 50,000 reps with that. So when you have that kind of so it's within usually within 15-20 seconds, I'm going to be able to tell you, hey, this person is good, no they're not, this is what they're going to struggle with, and kind of go from there. So on a personal note, things have really evolved. So, Chris was I think we're the same age, but a year younger school wise. But from an injury standpoint, it's interesting that we're working together, because he had some kind of chronic foot stuff, and his nickname his nickname, this is dating us back in the Jay-Z days, was Big Gimpin. So we always give him a hard time. Big Gimpin, excuse me, please. As he was
crutches are in a boot 90% of the time.
I love it. Well, thank you guys for sharing. That was outstanding. From here on out, the Big Gippin is going to sign us off.
Right.
Excellent. Yeah.
Good to see you, Todd.
See you, Todd.
All right. Good to see you guys too. Yeah. Take care. Bye.
Bye-bye.